Our final witness is governor and doctor. I've always found senators like to be called doctor, if they are one. So Governor and Dr. Josh Green. Governor Green is the 9th governor of Hawaii. He earned his degrees in biology and anthropology from Swarthmore College and an MD from Penn State's College of Medicine. Dr. Green served 2 terms in the Hawaii House of Representatives, 3 terms in the Hawaii State Senate, and a term as lieutenant governor, during which he was the state's point person addressing the COVID pandemic. Dr. Green was elected governor in December 2022. Governor Green.
Thank you, Chair Johnson. Thank you so much for welcoming me. Thank you, Ranking Member Blumenthal. Thank you, Senators. First of all, I'm coming to you as a physician. When I speak as a doctor, I'm here to say that vaccines save lives, period. I care about saving lives. You care about saving lives. Everyone in this room, I believe, cares about saving lives. But I've seen firsthand children dying from the spread of preventable diseases because of vaccine skepticism, because people lose faith. I've seen the lives of some children in one house who are vaccinated live, while children in the house next door who have not been vaccinated die. And we saw a lot of this during COVID. I want to tell you a little bit about my COVID experience as the COVID liaison in my state, a state of 1.4 million people. And let me preface this by saying we worked very closely with President Trump and his team. And then subsequently, as Lieutenant Governor, I was able to work very closely with President Biden and his team, and I appreciate them both. I appreciate that President Trump, using Operation Warp Speed, got us a vaccination in an extraordinary time. We were desperate as healthcare providers. I worked as an emergency room physician virtually every single weekend for 20 plus years, including through the whole pandemic. And this is what I saw. I saw people dying of terrible disease when they caught the Delta variant of COVID especially. I saw people recover better when they had been vaccinated. In Hawaii, we had the lowest mortality rate in the country. We had the highest vaccination rate in the country. People have asked me in the course of the prep for this hearing, well, is Hawaii safer because it's a tropical island state? No, actually, it's quite the contrary. We had COVID coming from east in Asia, where it originated, and west, travelers from the mainland. But we put together programs based on science. Day by day, I counted case after case after case because there was so much uncertainty. And I was able to share in our state where we had infectious disease doctors, where we had extra need for ventilators, where we had extra need for vaccinations, where the rates were lower. And day by day, working with all the healthcare providers in my state and listening to others, not mandating. I'm not a mandate guy. That may come as a surprise to some today. We were able to make sure that we had a science-based response. We put together a safe travels program which tested anyone coming into the islands so that they wouldn't travel or that they would isolate or quarantine if they were positive so they wouldn't spread the disease. And over time, we had the experience that no one else had. We saw death rates constantly lower than all the other states with the single exception of Vermont on occasion. I tell you this because we have to follow science, and I truly believe that we can't politicize science or vaccinations or any of these public health matters. And it's very important going forward. This is where we should unite with one another. We should heal our country together in this space. Now, another experience I had, measles. I was the doctor that was asked to go to Samoa when they had their outbreak of measles. Why did they have their outbreak? Because they lost faith in the vaccination program. And it was tragic. The Children's Health Defense went there and they scared people. After tragedy, admittedly, it should have never happened. I had children die in my arms who were not vaccinated but died of measles. This beautiful boy was with me and a pediatrician, Dr. Nadine Tansala, had a terrible case of the measles, and some of his relatives passed away from the disease. But we went there and we vaccinated 37,000 individuals in 48 hours, and the measles just stopped. And I say this because this is what we have to look forward to in the future if we somehow fall into a place where we don't believe in vaccinations any longer. And we shouldn't do it blindly. We should study them. We should check for safety. Absolutely, that is essential in science. But these vaccinations save lives. They saved many lives during COVID. In my state, they saved over 10,000 lives. We anticipated mass casualties, which we never saw because we fought this disease with great intelligence and great acumen. I will tell you this. There are lots of things to share today, Protests resonated through the COVID experience in my state. People protested at my home, around my family. But the leader of the protests ultimately, after I was worried that he would catch COVID, did exactly that. Ended up in grave, grave peril. His wife was in the intensive care unit. His name was Witkoff. He later disavowed the protests against the vaccinations after seeing individual after individual after individual be intubated and go into the ICU because he experienced it. And that's what we as physicians see too often. Once a tragedy occurs, and my heart is with everyone who had any kind of reaction to the vaccines that we're talking about or loses a loved one. Of course, we love our fellow mankind, but we cannot turn away from science. So these are some of the things I wanted to share with you today. Ultimately, we have to decide whether we're going to be committed to public health in our country. And right now, we are in great peril. It is absolutely my firm belief that vaccines have saved millions of lives over the last 50 years, 150 million by many people's accounts. It's decreased infant mortality by 40% globally. And we have to continue to commit ourselves in this way. So I'm concerned. I'm concerned that as we end up in a politicized discussion, that we will move away from science. We will not trust one another, experts. We will not trust one another, and we will end up in conflict. So what I would say is this. Let's work together. Let's find a way to actually find the common ground to protect our children. Let's find a way to make sure our public health system remains intact, not taken apart by the current approach where HHS is jettisoning many of its people, many of the billions of dollars, perhaps many of the vaccinations. This is our opportunity to come together, and I'm sure we'll talk more about this as the hearing goes on, but I'll say one last time. Vaccines save lives. I've given vaccines, I've taken vaccines, I've treated people that didn't get vaccines, and it's broken my heart when they've passed away.
Thank you, Governor Green. Quick comment. I'm not aware anybody on my side of this issue has politicized it. The accusation is always that we're not. You did state, by the way, 10,000 lives saved in Hawaii. I would love to have your citation on that, so if you can give us a study so we can put that in the record. And any other citation give us on the millions of lives saved by vaccines as well. I mean, I want to know the truth. Just real quick, I've got a couple other charts I want to put up there. This is a chart, a lot of people produced it.
Chairman, if I could just interrupt for 10 seconds over here.
Sure.
Is today's just a point of order? Are we talking about vaccines or are we talking about the COVID vaccine?
Well, specifically, we were talking about the hiding of the safety signal on myocarditis.
So we're not talking about all vaccines.
We can talk about anything you want to.
Okay.
I mean, again, it has obviously opened up because we're also talking about the corruption of science. And I think science has been corrupted. So fair game. So, and again, I appreciate you staying here and stick around and ask a lot of questions. I think you'll learn an awful lot. Put my time back on the clock. No, I'll take whatever I want. This is a chart. Again, I was looking at the VAERS. You know, I had been.
Mr. Chairman, that's not the way I ran this subcommittee.
I had been. Well, this is a different. Again, I'll be very generous. Okay. I was actually instructed as a non-doctor what the COVID injections were. Encapsulated lipid nanoparticle that was designed to permeate difficult to permeate barriers. So they lied to us when they said they'd stay in the arm. They knew it wouldn't. They had a study. The Japanese regulators uncovered that when they did do a biodistribution study in rats, it distributed all over the body. So that was the first lie. Didn't really talk about too much about the toxicity yet of the lipid nanoparticle, but it goes all over the body. So I was aware, and again, that this was not a standard vaccine. This isn't a attenuated or dead virus that the body reacts to. This actually hijacks the cell, has the cell produce the spike protein, which is toxic to the body, which means the body attacks it. Again, I'm a layman, but it's pretty simple for me to understand this. So I was aware of this like in October. So I'm watching VAERS, and so I'm publishing these charts, and I'm being censored. I see the next chart number 2. This is the full history of VAERS and the number of deaths being reported associated with the vaccine. You got a couple hundred a year until 2021, and yikes, 21,725 deaths worldwide. Why? And everybody's saying, no, this is safe and effective. The vaccine injured were being gaslit. They weren't being treated. They're still being gaslit. There is no, by the way, there is no compassion, Governor. I could fill this room with photos of people who are dead because of the COVID injection. I could fill the room. And that is being denied. That is being denied. It is being denied, and these people haven't been able to get help. I held an event in Milwaukee in June 2019 and 2021, and all the vaccine injured, those women, all they wanted was to be seen and heard and believed, and they are not to this day. Okay? So again, they're not the ones politicizing. They just want to be helped. They want compassionate doctors to treat them, to recognize what caused their illness, not gaslight them, not deny that it exists. But anyway, so you take a look at this chart, and they're still denying that this, nothing to see here. This is safe and this is effective. Okay? Next chart. This is the current VAERS chart. 38,607 deaths reported worldwide associated with the COVID injection. And we know VAERS dramatically understates, by a factor of 10, 100? We know it understates it. 9,228 of those deaths are occurring on the day of vaccination, the 1 or 2 days. Okay, I know VAERS doesn't prove causation, but man, that's a correlation we should have been looking at, but they ignored and they censored. But enough of that.